Welcome back to Beyond Boundaries, an Action Lab podcast. I'm Dr. Kim Baker.
And I'm Dr. Robert Hammerberg. In this episode, we're diving into a critical topic within maternal and child health, maternal mental health. Maternal well-being is essential for both parents and children, yet so many challenges remain in access, awareness, and support systems.
To help us explore this important issue, we're joined by Dr. Dorothy Mandell, a faculty expert whose research focuses on how early experiences shape neurocognitive outcomes and how we can better support families during the transition to parenthood. This conversation sheds light on the complex factors influencing maternal mental health and highlights innovative approaches to support mothers and families. Let's get started. Dr. Dorothy Mandell, we are so excited to have her here sharing more about her work. Our first question for you today is, how did you find your way into public health? Simply, what we like to ask all of our guests is, did you choose public health or did public health choose you?
I've been thinking about that quite a bit. Did public health choose me? I have a very roundabout way into public health. When I finished my undergraduate degree, I actually worked for the Department of State Health Services as a statistician. And during that time, I worked as the statistician for the Child Fatality Review Program, which was incredible, an incredible opportunity. And about a year and a half in, somebody looked at me and said, what do you really want to do? And I told them, and they said, you need a PhD for that. So go back to school, which I think was their way of gently and nicely kicking me out. But I did go back and get my PhD, and I got my PhD in developmental psychology because my undergraduate degree really focused on, it was in psychology, and I worked in a developmental lab at that time, and it was like all neurons in my brain firing. I loved it so much. So I got my PhD in developmental psychology, but at the same time, like this whole experience in public health as an undergrad really shaped everything I did, of looking at it from an applied perspective of how do we improve the world for kids, and how do we improve the world for parents. So after a roundabout way, I came back into public health. Maybe public health did find me.
That's
Yes.
awesome. Thank you for sharing that. It's good to hear kind of that theme that we hear often about public health finding you, because it was something about the work or experience that you had. You mentioned like the applied work that you got to do that just felt like right, or felt like home, or felt like more of what you wanted. So thank you for sharing that.
Yeah, I love that. I feel like a lot of people in public health talk about this roundabout path where they start there, they leave, they come back. So what inspires your interest in maternal and child health?
Maternal and child health is so exciting to me for so many reasons. One, I find kids just so fascinating. That's why I went and got my PhD in developmental psychology. Their brains are just awesome. Like, you start from just small number of neurons connecting into, within 3 years, you have a brain. Like, you have a real brain sitting there that almost looks like an adult brain. It's not, but it almost looks like an adult brain. The changes that happen in that short amount of time are incredible, and it's so fascinating. And I think from a public health perspective, it also brings in this aspect of this incredible opportunity that we have to do something during that time frame to actually have multi-generational improvement. And maternal and child health is really the only place you can do multi-generational improvement and multi-generational prevention programming and multi-generational interventions. So I often talk about the work that we do as 2-gen work, and that to me is so incredibly fascinating, of this idea of intervening on a child, but you never actually intervene with the child at all. You intervene with everything around the child. And it's complicated, it's really cool, and I find that super fascinating.
Awesome. Thank you for sharing that. I mean, it's really a greater understanding of just public health in general when we
Hmm.
apply the impact that you can have generationally through mother and child focused work initiatives, policies, programming. Absolutely. So within that same, I mean, you're kind of leading us right to the next question,
Yeah.
right? Like from your perspective, what does maternal health mean to the field of public health? Like why should this be an essential area of focus? Like, still.
I I think it's from that perspective of looking at it from the long haul perspective of a lot of what we do in public health is very short term. As no offense to my colleagues, but it is short term. Like we want to prevent disease, we want to prevent an infection, we want to vaccinate to prevent this. But we're talking when we intervene in a maternal and child health space, we're talking multi-generational impact that we can have, not just the intervening to help the mom's health at this moment in time, but we're talking about helping the health of the grandchildren of that child and the child of that child. So this gets into when we talk about like generational trauma, intergenerational trauma, and intergenerational transfer of health and intergenerational transfer of traits. That unit, intervening along that unit of that mom and that baby, or that father and that baby, will actually improve health generations to come. And this is the only place that we can do that. We can't do that when that baby becomes an adult. We are not going to engage in intergenerational health improvement. So, from my perspective, this is the place where the legacy of health improvement happens for time and time and time to come. This is where we can start building a healthier society and a healthier generations to come.
Yeah, Dr. Mandell, you talked a lot about how, this is long-term work. It's complex. With
Mhm.
this episode focusing on maternal mental health in Texas, what do you see as some of the challenges and opportunities of addressing that in the state?
Yeah, a lot of the work that we've been focusing on is the understanding of how systems impact mental health and mental well-being. And we've been doing a lot of work focused more like on systems improvement than we have on intervening with the mom and the baby. And there are a couple of different reasons for doing that. Is one, this realization of when you have a mental health, when you're struggling with mental health, there's not the entire symptom of struggling with mental health is that you can't do anything to improve your mental health. It's a silly situation that we put ourselves in to say, I'm going to ask this woman who's suffering from postnatal depression or depression period and has all these other psychosocial stressors going on, then I'm going to ask her to pull her up by her bootstraps and go figure out how to get therapy. So what we're trying to do is intervene on the provider side to say you need to open your door a little bit more and you need to actually navigate women into these services, because the services we don't need new services. We need more providers, but we don't need new services. The evidence base for therapy is quite high. The evidence base for antidepressant drugs is quite high. The evidence base for combining them is even better. We don't need new evidence to show that you can intervene on mental health, to improve mental health. We don't need that. What we need is to figure out how to get women into those services. And so we have been focusing more on the provider side of what are the provider-based barriers for screening for mental health, screening for depression, screening for anxiety, doing basic level prevention programming in the clinic or basic level prevention programming for home visiting as well. And seeing that as the opportunity to really address this issue. Because if we just focus on the mom or the dad, then we start getting into, well, it's their fault for not seeking services. but it's not. It's really the provider who has to take responsibility for getting them into services. So that is one of the biggest challenges that I see, is changing provider attitudes and changing provider systems of coordination and changing providers' ways of believing that they're part of the prevention continuum when it comes to depression, anxiety, PTSD, the entire gamut of mental disorders.
Thank you so much for your work on that, because that system level intervention and those structural changes, you're absolutely right. I mean, it furthers this intergenerational change, because we're not
Yeah.
like placing the blame at these families who are like in dire straits. And so, how can we make access more easier for them? Thank you so much. So, with saying that and all the work that you're doing on the provider end, making it accessible, trying to get them to understand what barriers that they may have in place, like, what do you think is still needed to improve these outcomes? And specifically, like, you're already talking about the work that you're doing that's doing that, but like, where do you see the biggest gaps? Like, or where are there still improvements needed on this structural system side?
Yeah. I'll pick two. I'll just pick two of the places that we see improvement. One is actually in the screening process, and we're doing a lot of research right now with home visitors and other parent service providers. So home visitors, parenting support providers, ECI as well, early childhood intervention. One of the things that we're trying to work on with these providers is recognizing that asking about depression, asking about anxiety, whatever mental health disorder we need to ask about, whether that is through an evidence-based screener or having a conversation, that is a relationship building opportunity as opposed to a checkbox. Because we see that when women get screened checkbox ways of like, here you go, here's your Edward. How many of us have walked into a primary care doctor and recognized that we were being screened for depression? Me, just on my last PC visit. And I said, I wonder what they're going to do with this. And they did nothing with it. Not that I screened high or anything like that, but I almost faked it just to see what would happen. Because one of the things that we hear on the women's side is like, yeah, I filled out the screener and then nobody talked to me about anything. There was that was a missed opportunity to build a relationship with her, because maybe she didn't tell you the truth on the screener because she didn't think. But if you go back and have the conversation with her, that opens the door saying, actually, I'm really stressed out. I'm really struggling. Actually, I have this, or I'm just so anxious I can't sleep at night. And that opens the door to one, building a relationship, and two, being able to navigate her into services or provide prevention services to her at that moment in time. So that screening process, and recognizing that screening process isn't just handing somebody a checklist, but that screening process as a conversation is one of the big barriers that hopefully we're going to start addressing soon, especially in our home visiting research. The other biggest challenge that I see related to mental health disparities is the lack of prevention services. And one, this is one of the stigma changes I think that we need to have around mental health, is seeing that mental disorders are an inevitable outcome. And you see this a lot in postnatal depression, of this idea that postnatal depression is an inevitable outcome and there's nothing you can do to prevent it. But in fact, there is a lot that you can do to prevent it. And there's a lot that you can also do to mitigate it through high quality prevention-based services. And getting these prevention services into clinics or into parenting support programs or into home visiting is also a major, major challenge, because that requires them changing the way that they're interacting with women. That requires them bringing in another service line that may or may not be funded if you're in a clinic, a healthcare clinic, but it is a necessary component because we can't just keep pushing everybody into therapy and waiting until it becomes an actual disorder, because there's not enough therapists, there's not enough psychiatrists. We need to move upstream into a prevention-based program. And I see that as a major challenge of overcoming that idea, especially on postnatal depression, that it is an inevitable outcome.
So like almost like mental wellness at the structural level before
Totally.
we get into, right, which we are so far from going. I
Yes.
appreciate your focus on that screening process, just because personally, anecdotally, I can remember having my first child, and I think this is when they were doing the screening at the pediatrician office, because it's like, the mom will show up at that first visit, right? And so get her then. But I remember the paper it was so grayscale. I could hardly understand the questions just because I could barely read them. So I felt like it really didn't do anything, right? And no one followed up. I remember vividly saying some support here would be nice, but even the screening tool wasn't legible. So thank you so much for that attention and focus on that.
It's such an incredible problem, especially with the screening tools. And I want to also shout out to pediatrics, especially pediatrics in here in Texas, who have done an incredible job of stepping up to do postnatal depression screening, and who have really, really taken the mantle and tried to figure out how they screen somebody who is not their patient. And it's such a big, and they're catching more than OB is, because they actually see families postnatally, but something else needs to be done too.
Absolutely.
Something else needs to be done.
Yeah, thank you for pointing out those barriers. And the home health service sounds like a really exciting direction that you're heading in. Are there public health initiatives or partnerships or policies that you think would better support maternal mental health?
So many. One big policy, and this goes back to the shout out to pediatrics in Texas, is I wish there were a way that pediatricians could bring mom in as their patient. Going back to a family-based focus. So when I talk to my family providers, they're like, dude, I do that. I can screen everybody in the family for it, and I can do something about everybody in the family. So like our movement away from family medicine, I would like to see some steps back towards family-based medicine, especially early pediatrics. And integrated pediatric and OB care would also be a really nice policy to see happen. But I also don't want to put this all policy on the level of healthcare providers, because that's not really, they're not in a position to do good prevention. That policy needs to be back into understanding and funding programs that promote mental wellness and destigmatizing the utilization of mental wellness programs. So whether that is something that is ancillary but connected to OB, so OB can easily get women into mental wellness programs and mental disorder prevention programs, or whether that is a community-based program that is open to everybody. The increase in parenting support and transition to parenting is one of those places where we can have better policy and funding around. We see women who are involved in these programs and families who are involved in these programs have lower rates of anxiety. And we're starting to see some evidence that they also have lower rates of depression and stress. So it's these policies, yes, we can do more on the healthcare side, but we also need to do more on the social service side, and enable and allow social service to, one, fund these prevention programs, and two, appropriately bill these prevention programs so that they're properly funded and sustained.
Dr. Mandell, is there anything that we didn't ask you that you would like to share with our listeners?
I would just say that one thing I want to say out loud is that sometimes when we say maternal and child health, I think that a lot of folks have this idea that when we talk about children in particular, we're talking about something easy to do. We're talking about something cute and doing these cute little interventions and doing really easy work around it. It's actually incredibly complex work. It's incredibly complex interventions to do, and it's an incredibly like mind-bending place to be and challenging place to be. So I would just also say and encourage any guys who are listening that you have a space in maternal and child health. You are needed in maternal and child health, and you are needed to improve intergenerational health.
Awesome. What an awesome note to end on. Thank you so much for your time today, Dr. Mandell.
Thank you.
Thank you, Dr. Mandell.
We'll also hear from Dr. Jennifer Bourgeois, a postdoctoral research scientist at the Center for Justice Research at Texas Southern University. Her work bridges social justice and maternal health, particularly in communities impacted by the criminal justice system. She also integrates mindfulness and yoga to support wellness and rehabilitation. Dr. Bourgeois, thank you so much for joining us.
Yeah, thanks for having me.
We're thrilled to have you as part of our Community in Action segment. First, we want to start off with the question that we ask everybody that joins us on the pod. Tell us a little bit about your journey into the field of public health, and did you choose public health or did public health choose you?
Okay, that's a good question. Taking me back down memory lane here. I would say it's kind of a mixture of both. So I finished my undergrad degree in forensic science, and instead of continuing down the medicine route, I decided to pursue my master's in criminal justice. And then after I completed my master's in criminal justice, I took about a 10-year, I don't want to call it a break, because I worked various positions within criminal justice. I did a lot of different jobs within criminal justice. And that was amazing experience to have the practitioner experience of what it was like to work in the field. And then after about 10, 11 years working in the field as a practitioner, I was presented with an opportunity to return back to school and pursue my PhD in administration of justice at Texas Southern University. And during that time, my focus was on parental incarceration, really diving into the risk and the resilience of individuals, specifically children, who are impacted by having a parent incarcerated, and learning about all the different cascading effects of what it's like to be impacted by incarceration. And then also during that time, I became a community partner with the organization that was doing a needs assessment of children that were impacted by having a parent incarcerated in the Harris County Jail. So it was like this common thread that just kind of just made its way, and full circle, where a lot of my work at the Center for Justice Research, it's about understanding crime through a public health lens. So I would have to say public health chose me. So it's kind of fascinating when I think of it about that. Yeah.
Well, it sounds like you actually chose public health, but you didn't know it.
Yeah, exactly. I didn't know it, but then it all just kind of became full circle, which is pretty cool.
That's awesome.
Yeah.
Thank you.
Yeah.
Yeah, thank you. And you've already hinted a little bit about the work that you've done, but we'd like to hear more. So tell us about the work that you do and how it relates with maternal and child health.
Yeah, very good question. So I do a lot of different things, right? So my research agenda is pretty broad, but one specific area that relates back to maternal health is the work that I do with families impacted by incarceration, and looking at what that looks like through this public health lens, but also a population lens as well. So looking at the broad picture of how, when a person is incarcerated, what effect that has on the family member, from their wellness to their health, as well as looking even more specific at that particular population, the disparities that may be impacted by having a family member incarcerated. And another area that I'm really excited about that I get to be a part of is one major study that we're doing at the Center for Justice Research is in collaboration with Baylor College of Medicine. And we're looking at different variables and different metrics such as socioeconomic status, environmental justice factors, involvement with incarceration, and how those particular variables have an impact on maternal and infant health. And then when you add on to that as well, my community engagement. So on top of everything else that I do, I'm also a yoga teacher, and weekly I go inside of the Harris County Jail, specifically at the Women's Empowerment Center, and teach yoga and mindfulness practices to incarcerated or justice impacted women. So it's a lot of mixture of research infused also with community engagement and volunteer, where my research world collides with my community engagement world.
Yeah, you do so much in support of the incarcerated community and in many different areas of that work, so thank you. But to lean a little bit more into the mental health and well-being space, how integral do you feel like maternal mental health is in the field of public health in general, and then also within the community that you're working with?
Yeah, it's very important because the well-being of individuals, oftentimes we just think of it as a silo, as physical health, and we don't look at all the other areas of wellness such as mental health as well. So by looking at those things as silos instead of in its totality, oftentimes we do not recognize the challenges that come with that, like the lack of access to mental health resources. And by not only engaging with the community, but also individuals that have been removed from the community, that are just as impacted or incarcerated, you really start to see kind of the full picture about why mental health resources is needed. When an individual doesn't have quality of care, whether or not it's physical health, it also can have trickle-down effects or these cascading effects with their mental health as well.
So I'm curious to learn a little bit more about your experience as a yoga instructor in the correctional facilities. A lot of times it takes practice and a build up and an understanding too of like what that means. And, talk to us a little bit about what that looks like and kind of the outcomes you've seen.
Yeah, so oftentimes when people hear that I teach yoga inside of a correctional facility, they think about the physical postures, so down dog and things like that, or doing a handstand or a headstand. But it's less about the physical postures and it's more about just the mindfulness and being present and the opportunity for individuals just to have a moment of stillness, a moment of silence, which does not happen very often at the local jail. But it's also a chance to kind of pour into their mental health. It gives me a chance to also recognize that when we talk about mental health and we talk about maternal health, we have to make sure that we're including everybody, not just individuals that are in the community, but also individuals that have been removed from the community and they're in a carceral setting. So making sure that they also have access to quality of care is very essential.
Thank you so much. And you mentioned Santa Maria Hostel, and I also do a little bit of work there, specifically working with the recovery coaches. And it's such a great organization that really puts the person first and does a lot of work in a lot of different areas, but their goals always are the same. And the goal is to really help support these women and their families.
Absolutely. And I love how they're always looking and willing to accept volunteers. I was connected with them just by picking up the phone, old school. Found them on the internet, recognized the name from some other community work that I've done before. And I just called them up, introduced myself, and said, hey, I'm a yoga teacher in the area, and I'm looking to donate some of my time and provide yoga and mindfulness sessions. And the response was great. It was, when can you start? Can you stop by and fill out some paperwork soon? Cool. And so I love when organizations are willing and ready to accept volunteers.
That's great. And we talked a lot about volunteering and what we can do, but for those that are early on in their career, still students, what advice do you have for them? How can they plug into maternal mental health?
Great question. Lean on your professors. Ask your professors what they're up to, where they volunteer at. That's step one. If you have a mentor, reach out to your mentor and see where they volunteer at, or if they have a connection with a community-based organization. As an early career, lots of different opportunities, reaching out to universities for fellowships, or if they have connections to community-based research or community-based organizations as well.
Yeah, thank you for that. And as we start to close out, we want to hear, like, what is the most exciting aspect of your work? What makes you want to wake up and continue to do all of the things you do?
Oh, that's a great question. There's a lot of things I'm excited about. I get excited about just being able to connect with the community, right? To listen to what they are going through. And not with the researcher hat on sometimes, right? Just humanizing individuals, just to hear what are some of the challenges that they're dealing with their, not just necessarily their physical health, but their mental health as well. So how can I hold space for those individuals? How can I plug them into different resources? So in the midst of teaching yoga at the jail, I oftentimes get asked about different resources in the community. And I always have like 3 to 4 organizations just kind of ready to, tell the residents at the Women's Empowerment Center about, so that I can plug them into and let them know, hey, when you're released, reach out to this organization. So that's very key. I'm also excited about the growing awareness about maternal mental health in criminal justice settings. So making sure that they're not excluded from the conversation, but they're included into when we talk about all the different resources that are available, not forgetting about justice impacted individuals. And I'm also very excited about the project that I'm working on at the Center for Justice Research with Baylor College of Medicine that I mentioned earlier, and just being able to dive into some of those other factors that can lead to negative outcomes for maternal and infants, but how we can, figure out what we can do in that space, lean heavily on finding some evidence-based solutions so we can have positive outcomes.
Dr. Bourgeois, it was great having you.
Thank y'all for having me.
Of course.
Yeah.
I'm excited about individuals learning about your work. And
Thank you.
It seems like there's so many opportunities too for faculty and students and other community members to connect with you and reach out to learn more about the myriad initiatives you're involved with.
Yeah, it's a lot of them.
And just thank you for the work that you're doing.
Thank y'all for having me. I definitely enjoyed it. We should have had like a little breathing meditation session,
we should
have grounded ourselves. Usually I do. When I go to conferences, I always start off with like a breathing grounding exercise. So yeah, next time.
Okay,
next time.
Sounds good.
Yeah.
Thank you.
Off camera, we'll do some yoga.
Sounds good. Thanks. That's a wrap on today's episode of Beyond Boundaries. We hope this discussion on maternal mental health provided valuable insights into the challenges, research, and innovative solutions shaping the field.
A huge thank you to Dr. Dorothy Mandell and Dr. Jennifer Bourgeois for sharing their expertise and perspectives. Their work is helping build a stronger support system for families and address disparities in maternal mental health care.
We're just getting started this season. Be sure to subscribe so you don't miss any upcoming episodes, where we'll continue to explore key topics in maternal and child health this season.
Thanks for listening to Beyond Boundaries. Until next time, stay curious, stay engaged, and keep pushing beyond boundaries.